Welcome to The Explainer. Today, we're opening up the black box of dental technology. Have you ever wondered what exactly happens behind the scenes after a patient gets a 3D scan? You know, how we go from these raw digital pixels to physical surgical perfection in the operating room? Well, that's exactly what we're demystifying today. Dental implant software. Okay, let's dive into this. How does a 3D scan actually become a flawless surgical guide? The truth is, behind every single guide used in surgery today is a seriously powerful software platform. This software acts as a critical bridge. It literally transforms patient imaging into an exact, patient-specific design. And it influences absolutely everything, from how accurately the patient's anatomy is represented to how well it handles your specific implant systems, right down to the final prosthetic outcome.
Here is our roadmap for today. First, core software functions. Second, major planning platforms compared. Third, features that drive quality. And fourth, to own or outsource.
Part 1, Core Software Functions, The Journey of a Scan.
So think of this as an exclusive, behind-the-scenes tour. Basically, implant planning software has 3 absolute core pillars that systematically take those raw scans and transform them into a 3D printable surgical guide. First up is imaging integration, which is bringing the patient's data together. Second is virtual implant planning, where the critical clinical decisions are made in 3D space. And third is the guide design itself, generating the actual physical geometry that's going to be sent off to the 3D printer. The magic really begins in that first step with registration. Registration is the precise alignment of CBCT bone data, so your DICOM files, and intraoral surface scans, your STL files, into a single unified 3D patient model. It's essentially this giant, complex digital puzzle. The software finds corresponding anatomy, like tooth cusps or occlusal surfaces, visible in both datasets, and mathematically locks them together. And I cannot stress this enough. This make-or-break alignment directly affects every single downstream decision in the entire guide design process. So how do we know if that digital puzzle is solved correctly? Well, listen to this number. 0.3 millimeters. A mean surface distance below 0.3 millimeters indicates excellent alignment. We aren't just eyeballing this stuff. The software mathematically calculates the surface matching algorithms to prove the accuracy. Anchoring this abstract concept of accuracy to a hard, unforgettable fact ensures that the foundation of our virtual model is rock solid before anyone even thinks about virtually placing an implant.
Part 2, Major Planning Platforms Compared. The Cast of Characters.
First up on our list is Anatomage, which you might also know as In Vivo Dental. This is one of the most widely used platforms out there, and its strengths are incredibly robust. It features comprehensive 3-dimensional visualization with interactive bone density rendering, which is just fantastic for assessing the surgical site. It also boasts a massive implant library covering virtually all major systems. Because of these tools, Anatomage handles complex cases beautifully, including full-arch restorations, bone reduction, and immediate loading scenarios where teeth are placed the same day. Plus, the cloud-based case management makes lab-to-dentist collaboration completely seamless. Next, we have Simplant by Dentsply Sirona. Simplant has a legendary track record. I mean, it's one of the longest established platforms on the market. It really shines with prosthetically driven planning. It actually integrates prosthetic wax-ups directly into the software, meaning restorations can be designed before the implant positions are even finalized. This makes Simplant an absolute powerhouse when working in the single-tooth aesthetic zone, where prosthetic precision is paramount and the final restoration dictates the entire surgical plan.
Then there's coDiagnostiX from the Straumann Group. As you'd probably expect, it features incredibly tight integration with the Straumann digital ecosystem, though it does certainly support other major implant systems too. It provides strict guide sleeve design tolerances and highly detailed bone quality assessment tools. But what's really brilliant about coDiagnostiX is the lab communication module. It is perfectly designed to facilitate a highly efficient, seamless case handoff between the virtual planning phase and the actual physical fabrication of the guide. Now, what's really interesting about this comparison is the stark contrast between our next 2 options. On one hand, we have Blue Sky Plan. It is completely free to download and use for commercial cases, which makes it a highly pragmatic choice for practices mindful of cost. And it's backed by a massive, super active user community. Contrast that with Planmeca Pro Max 3D on the other hand. This is a highly integrated, closed digital ecosystem. If you already own Planmeca CBCT hardware, this provides a seamless data flow directly from the scanner straight into the planning software, which is just an incredible workflow advantage for that specific ecosystem.
Part 3. Features that drive quality, raising the stakes.
We have to remember that beyond the cool 3D graphics and the cloud collaboration, this technology is fundamentally about patient safety. And when we talk about patient safety, we are talking about successfully navigating critical anatomy. Specifically, we absolutely must respect nerve canals, sinus floors, and adjacent roots. These are extremely high-risk areas. A mistake here has severe clinical consequences. This is exactly why sub-millimeter software accuracy isn't just a nice-to-have luxury, it is an absolute clinical necessity. The software has to allow the user to see the precise relationship between the virtual implant and these anatomical boundaries in real time.
So the crucial point is a stark warning. Software without this capability makes it possible to approve a guide design without verifying that critical anatomy is respected. We simply cannot rely on visual estimations. Effective software has to calculate and display quantitative safety margins and clearance distances as interactive measurements. To guarantee that level of safety, there are 3 essential software features you absolutely must ensure are being used. First, quantitative registration reporting. We talked about that 0.3 millimeter metric earlier. Second, an exact implant library. The software must include not just your system's manufacturer, but the specific product line and drill protocol, or your physical drills literally won't match the guide sleeves. And third, guide design customization. You need the ability to add inspection windows, retention pins, and custom guide body geometry so it fits the clinical reality. I strongly urge you to verify with your lab that they are actively utilizing these specific, non-negotiable features for your cases.
Part 4. To own or outsource. The practical takeaway.
So, after seeing all this complex software, work, tracking nerves, and calculating surface distances, we really need to resolve the biggest looming question. Do you actually need to own this planning software yourself? Like, do you need to buy it, install it, and learn all the intricate ins and outs of these platforms to practice guided surgery? No, absolutely not. You can breathe a huge sigh of relief right now. Dentists do not have to become software engineers to safely practice guided surgery. You can entirely rely on a specialized guide laboratory to do the heavy lifting for you. You just submit your imaging and case information, and the lab uses its advanced software and expertise to produce the final guide. And this brilliantly illustrates the 2 primary business models. In-house planning makes total sense if your practice has a very high implant volume, or if you demand direct control over every single click of the process, or if you actively use the software to show patients their digital plans during consultations. But a lab partnership is best for pure efficiency. Utilizing a specialized lab like Guided4Excellence means they handle all the planning, the design, and the software expertise. For the vast majority of practices, outsourcing is simply way more efficient and consistently produces better results.
Let's quickly wrap up by looking at some of the most frequently asked questions, just to show how adaptable all this is. First up, scanner compatibility. All major platforms accept universal DICOM exports, so your scanner brand and your planning software brand don't even have to match. Second, what about a hybrid workflow? Absolutely. If you want to plan in-house, but just don't want to deal with the 3D printing part, you can simply export your STL design file to a lab for fabrication only. Finally, software updates. Major platforms update regularly to ensure compatibility. The big takeaway here is that this digital workflow is incredibly flexible, no matter what hardware your practice currently relies on.
Which leaves us with one final provocative thought. Is AI the future of implant planning? Well, the future is already arriving. AI-assisted anatomical segmentation, where the software automatically identifies structures like nerve canals, is actually already available in platforms like Anatomage. And fully AI-driven implant position suggestions are in early commercial availability, though of course, they absolutely still require clinical review. It really leaves us pondering the rapid, exciting evolution of dental technology and exactly how these software platforms will continue to transform patient care. Thanks for joining me today on this explainer. Keep learning and keep embracing the tools that drive excellence.